Hello, welcome. Yes, this is the examination room. Yeah, it's a bit dramatic in here, I know. Please take a seat and relax, feel at home. I am Dr. Brain. Funny. Pleasure to meet you. Okay, great. So, pulling up your chart here. It looks like we are going to be doing a cranial nerve examination today. Great. Have you ever had a cranial nerve examination before? Okay. I have a couple of times. I used to do high intensity sports and I've got a couple concussions, so I had to do a couple of these tests. And may I double check your name and your birthday? Okay. And wonderful. And are you still using the same pharmacy as last time? Wonderful. Okay, let's begin. It will be very soothing, I promise. I chose all of the good scents and flavors today. Thank goodness. So, there are going to be 12 different nerves that I will be testing. They are 1 through 12, and the first is typically the most calming one. It is your sense of smell. And we will be moving on to the olfactory nerve and testing it after a couple of basic questions. I know your primary physician already asked you a couple questions, but I need to know some as well. So, we already looked at your chart as to why you're getting a cranial nerve examination. Are you feeling better since last time? Okay. How has your sleep pattern been? Okay, that sounds usual. When I had my concussions, I really couldn't sleep at all, so I understand. Okay, I think we're ready to begin. Going to be giving you 3 different smells. They could be a bit unusual, but you will not know. I have different caps. So, the first one is this. And I'm going to spray a bit into the lid here. Okay. And I'm just going to let you get a glimpse of that smell. Do you know what that was? Yes, wonderful. That is coffee. Great. Very prominent smell. Okay, let's move on to the next. Going to spray that into the lid. And what a lovely smell. Let you catch that smell. Do you know what that was? Yes, that is rose water. Very soothing smell. Reminds me of like a spa. Good on you for that one. Let's write that down. And third, let's give this a little bit of a spritz. Okay. And you picked that up right away. That is lavender. Very good nose there. It's like we typically choose a bitter smell, a sweet smell, and something that is dramatic, sometimes a mint, you know. Okay, so that's good. That seems to be doing good. Next, we're going to be testing your optic nerve, which is just your sense of sight, a typical vision test. And I'm going to get my other glove on for this because it will be touching around your eye area. So, if you would allow me to, I'm going to just gently press around your eye area. Great. So, just going to Does that hurt at all? No. Okay, good. Do you see anything in your eyes now that I press on it? Like perhaps do you see any visions of things? No? Okay. Now I'm going to be doing a general eye test, which will cover the most basic cranial nerves for vision and facial sensitivity, optic nerve, the oculomotor nerve, the trochlear nerve, and the 5th and the 6th and 7th nerve. Now this is just for vision, looking down, looking side to side, looking up, and your ability of sensation around the eyes. Okay? Great. And if you could just look at me in the eye, I'm going to test this eye first. 3 quick flashes of the bright light. Okay? 1, 2, 3. Okay, now a bit closer. And 1, 2, 3. Great. The other eye. So, 3 quick flashes. 1, 2, 3. Okay. Keep looking at me in my eye. A bit closer. 1, 2, 3. Okay, all good. Nothing that seems to be disturbed. Now I'm going to ask you to follow the light with the brighter light and try not to move your head. Just move your eyes, okay? Great. And I'm just going to shine the light. Please just follow the light and do not move your head or neck. You seemed to move your head a bit there. Very common, especially if you're feeling some sort of unbalance. So, gotta write that down. We're now going to be testing the 5th nerve, which is your jaw and facial movement with facial sensations. And I'm going to be using a fun little tool here. And I may be poking your face with my finger or with a bit of a sharper object, the tongue depressor. And for this, I would like you to close your eyes. If you feel a very gentle touch, just say gentle or soft. And if you feel a sharper object, such as the tongue depressor, please say sharp. Thank you. So we're just going to soft, soft, sharp, 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 soft, 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 sharp. Wonderful. Let me write that down. Okay. Now we are going to be testing your jaw movement, just like if you could please clench your jaw. I'm going to put my hands around this area and just please clench your jawline. Just okay, that is looking good. You seem to be clenching the jawline well, nothing odd or irregular with that. Next, we're going to be testing some general facial features with your facial nerve. Can you give me a shocked face, like... Okay, yeah. Please try to raise your eyebrows as much as possible. I'm going to put my hands and feel the muscles on your face, so please just elevate your eyebrows as much as you can. Wonderful. Can you make a smile for me? Just thank you. Yeah, this one's a bit funny. So just try and make sure that you activate your jaw with that as well. Okay. Can you now make like an angry face, like furrow your brows? Okay. Wonderful. That looks fantastic. Okay. Now we're going to test your 8th nerve, which is for balance and hearing. Sometimes when you have vertigo or a concussion, balance and hearing will be thrown off a bit. So I've got a couple of sounds, and I want you to let me know what side the sound is coming from. Please close your eyes. Okay. I'll tell you what these are, though. I just have 2 medical scissors. I won't be cutting your hair, so please close your eyes and let me know which area the sound comes from. Okay. Wonderful. Yes, both sides on that one now. Yes, this side. And on that side, perfect. Nothing wrong with hearing. I'm now going to feel behind your ears. I'm going to put pressure there. It might give you vertigo. If it does, please let me know. So I'm just going to be reaching right behind the ear, and I'm going to put pressure on the area. So if it feels any sort of discomfort, please let me know. A little bit? Okay. And do you feel a bit woozy or... Okay. Good information to know. And on that side, not so much. So focusing more on this side again. Going to put a bit more pressure back on that area. Yeah, okay. So more of chance of vertigo on that side. Good to know. Going to be writing that down. And vertigo and hearing is actually all about balance. Have you ever experienced vertigo before? Yeah, it makes it kind of feel like the world is spinning. It's really uncomfortable. But typically caused by an imbalance in the area behind your ears connected to your brain. So especially with concussions or perhaps even sleeping on your head wrong, it can cause extreme vertigo. It's not fun. Next, we're going to test your sense of taste. I have a couple of scents here. We're going to be getting another tongue depressor. And I've got some tastes. There's only 2. And both of these bottles have the same label on them, so you don't need to close your eyes. So, they are quite strong at first. I will admit I've actually had this, I've actually tasted this before for fun. I'm more letting you know now that it's a bit strong, so we're going to put a drop on there for you. Let me close that. Okay. And if you could please just open your mouth and give this a taste. Thank you. Yes, I can see you've made quite a reaction there. Do you know what flavor that is? Yes, that is a very, very strong peppermint. I wish we had something not so dramatic, but it's very intense peppermint, very cooling. We're going to be moving on to a new flavor profile now. This might be a little bit shocking as well. And let's put this one. Okay. And please give this one a taste. This one's also just as shocking. Yes, that is a candy. Particularly, it's cotton candy. It's just super sweet. I couldn't tolerate this one, to be honest, but that's all we have. It's a very distinct flavor of candy. So we've got the bitter mint and the sweet candy. You did good there. I've had it before where someone has tested me and given a mint and then an orange. Not good. Okay, now we're going to test the 10th nerve, which is for speech. Could you please go la 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 la? Yes. La 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 la. Wonderful. And now, could you go ooh? Yeah, just go. Okay. These are sometimes the most important parts is speech and pronunciation, because if you are unable to talk, that could mean something significant, so I'm gonna write that down. We're on to our 10th nerve, which is the accessory nerve. This is shoulder shrugging and head rotation. Could you please shrug your shoulders for me if you can? Yeah, just gently shrug your shoulders. Okay. Seems to be a little bit limited. And do you have the ability of rotating your head? That is if it doesn't cause vertigo. Just side to side. Okay. And can you do like a head rotation like that? Okay. Yeah. When I had a concussion, doing this was like the worst feeling on earth, so I understand if it is limited or if it does not feel comfortable. Do not do it if it does not feel comfortable. And last but not least, we're going to test your hypoglossal nerve, which is your tongue. And if you could, do you know how to like move your tongue in funny ways? That sounds like a joke, but that's actually what we test. Could you please stick your tongue out for me? Okay. And can you move it side to side? Okay. And can you lift it up and down? Okay. And did you feel any discomfort doing that? Any pain? Perhaps jaw pain that can actually happen? Okay. Okay, so based off of this, we've went through every single 12 nerves. I'm going to be sending a diagnostic analysis back into your primary physician. I'm just the examination physician for the day. You appear to be having some limitations with visuals and a bit from rotation and neck rotation, which is common, especially after having some sort of vertigo or perhaps some head trauma. And we're going to get you the treatment that you require to feel 100% again. Okay? Good. I hope it wasn't too uncomfortable. Okay. If you ever need any more information on this, I've also attached my email to the card. I'm going to be printing out a ton of information on how to take care of yourself, especially when movement is limited, so that you feel better again and you don't, cause anything to feel uncomfortable, okay? Wonderful. Thanks for coming on in again. I am Dr. Brain. Truly, it was a pleasure to meet you. And try to not move too much, okay? Wonderful. The printings will be back in your primary physician's office in a little bit. Great. Have an amazing rest of the day.